Best technique for lower blepharoplasty? Hi, I'm confused about fat transfer and muscle suspension. Can they both be done in the same surgery? I hate my bags and heavy upper lids, but don't want to look hollow under my eyes.
Thank you for your question. You submitted a single photo and you're asking what's the best technique for lower eyelid blepharoplasty. And you mentioned in your question that you're confused about fat transfer and muscle suspension, and that you have heavy upper eyelids and that you don't want to look like you have hollowness under your eyes after surgery. Well, I can certainly share with you my perspectives and my experience with this type of question, which is one of the most common questions we have come to us in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and dealing with eyelid rejuvenation and under-eye bags is the most common issue that we deal with in our practice. And certainly the procedures you discussed or you submitted certainly are amongst the spectrum of options that you can consider, and I understand it can be very, very much overwhelming. So whenever I try to help a patient understand their options, I think that there are very specific issues that first have to be understood. And so we'll begin first with anatomy, and with the under-eye bags, we'll focus on that. The under-eye bags are due to something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat from behind the eyelids pushes forward, creates a bulge, and makes the under-eye area look puffy. Now, when it comes to eyelid surgery, a lot of times people are afraid of looking hollow under their eyes after eyelid surgery. And it's been my experience that most of the time it's because of essentially two issues. Number one, the procedure is done in a way where the lower eyelid ends up sagging or rounding, and it's called eyelid retraction. Now that can make the eye look very, very hollow. The other side of that is that people don't often are educated about the area directly under the under-eye bags where the cheekbone is projecting, and so they feel like even though their bags are gone, they still look relatively hollow, and that's because they have a volume deficiency in their cheek area. Now, if you were to look at the medical literature about optimal ways to do lower eyelid surgery, you'd be overwhelmed by the numerous articles and techniques that come up when you do that kind of search. And certainly a lot of my colleagues do what they feel comfortable with, just the way I do what I feel comfortable with. Now here's my perspective on what I would do for you, and of course it's going to be a little bit different than what you might have been considering. And I'll explain to you what the thinking is. When you're dealing with fat prolapse under the eyes, then the goal is to reduce that fat prolapse. And so I do a procedure typically called a transconjunctival blepharoplasty. By doing this procedure, I do this procedure from the inside of the eyelid. I reduce the fat pockets, and I'm able to reduce or reposition and shape and sculpt the fat pockets so that the contour looks better. Now, typically when I evaluate a patient, I point out to them the cheek area as well as the position and relative elasticity of the outer corner of the eye. So if someone needs the outer corner lifted slightly or reinforced, that's a procedure that's done concurrently. If they need volume in their cheeks, they're either done at the same time, usually with an injectable filler, or done later with an injectable filler. Now, where does fat transfer and this muscular sling procedure or suspension procedure come into play? Well, there's a school of thought that if you were to add fat to fill the volume deficit, that is in continuity with the lower eyelid, then there is a value in creating an area that restores volume and camouflages the puffiness, and that technique is basically called fat grafting. Now, the problem I have with fat grafting is actually several-fold. In my experience, when patients have extensive fat grafting under their eyes to try to hide the under eye bags, they end up with a kind of a swollen appearance. And unfortunately, because of the techniques used in fat grafting, the muscle called the orbicularis oculi muscle can become fairly traumatized. And to counteract that trauma, which can compromise the position of the eyelid, causing lower eyelid retraction, a lot of my colleagues will do some kind of muscle suspension procedure to try to keep the eyelid from sagging. I feel that, and patients, and this is from direct experience, patients have come to me from around the world to have actually fat removed from their eyelid because of fat grafting. And having this chronic swelling and this instability of the eyelid requires a lot of work for a revision surgery, and this is an area that I specialize in. So I think that my recommendation would be different than a colleague's recommendation, where I would approach this as, and the basis again is, you want procedures, and this is something that's very important these days. You want a procedure that's likely to be satisfactory, that's predictable, and that is less likely to have problems or a prolonged healing process. Fat grafting by nature takes longer periods of time for healing and for swelling to resolve. Our patients want to get back to normal life and get back to work and back to their activities in a week. And so I think that my approach would be something that's different. Doesn't make anyone else's approach wrong, but it's important for you to understand the perspectives and the pluses and minuses. It is very important to also understand and really have a handle on what is the ideal outcome for you. This is no matter what, facial aging is a change, and what we want to do is help people look their best for their age. So I think that as you are learning more about these procedures, you need to take good notes and really understand the pluses and minuses of each procedure, and then ultimately make a decision and go with it. But that's my opinion on what I would do for someone with just the focus on the eyes and the photo that you submitted. So I hope that was helpful. I wish you the best of luck, and thank you for your question.